Next on our dope list, oh, an obstructed tube. Yeah, your patient just tossed a lung biscuit right into the ET tube. If you're transporting an intubated or a trach patient, you want to have a Ballard suction device attached before the transport. They should always be attached. So here's your ET tube, and let's review the Ballard suction. Now the great thing about a Ballard is it's a closed system and it's ready to go. The bad thing about a Ballard is it's a closed system and it's ready to go. So what happens, a lot of people attach these. This goes right here on the ET tube. This part's going to go off to the ventilator here. Right? It's a closed system. At the end here, take off this cap. This goes to the suction, right? And I can set my suction to whatever, 80, 90, 100, whatever I want. And then to actuate it, to actually apply the suction, I'm going to depress this little button here, right? So the thing's closed system, always ready to go, awesome. So, notice there's a little black dot up here. When you remove this tubing all the way after suctioning, you want to see that black dot. So during the suctioning, on the way in, no suction is applied. So we can just, it's a nice closed system. We can put it down through the ET tube here. And now here's that black line again. We're probably not going to suction that deep. There's that black line. So now, squeeze, apply the suction, and we're going to hold here where the ET tube is attached to the Ballard. We're going to pull back, straight back, until we see that black dot again. And this ensures that all the suction tubing is out of the ET tube. Now again, awesome, ready to go. We leave the suction on, nothing's going to happen until we compress this. However, I once had a patient manage to get this into their armpit and squeeze it, and I'm watching their sats drop, and I'm like, what the heck's going on? So, you have to lock this when you're done. After you apply the suction, you pull on the little knob, you twist, and you set it back in there, and now it's locked. If you need to suction, you pull up, you twist, and then you can actuate it again. But remember, this thing is a closed system ready to go. So if somebody happens to be leaning on this, like it's under the pillow or something, this should be out where everybody can see it and it should be locked at all times. So, suctioning, Ballard suction device.